Okay, well, I think we'll make a start. If you can just push put us onto the next slide, and I'll do an introduction for everybody. So for those who have arrived, I'm sure we might get some more people drifting in, but welcome and thank you for attending. We run a series of these workshops called Excel into Health, and it's aimed at businesses doing businesses with the NHS, and depending on what particular subject people want to understand or know a little bit more about, we put on a show like today. So today is about writing a strong business case to secure commissioning in the NHS. Just want to do some introductions. Obviously, I'm Steve. I'm a nurse by background, 20 years in commercial roles in medical device companies, and now 8 years at the Health Innovation Network. Got my colleague Indi, who does the same job as me. He's an accountant by background. Got Emma Balani, who's recently been on a course about writing these actually, so she's helped with some of the slides. Ruth, who's done commissioning and management roles, is another colleague of mine, and Phil has helped us pull this together today and is helping us keep the show on the move. So we've got some slides today. I'm going to apologise that this is quite a boring subject, and we're going to try and make it interesting. And I've got 5 of my clients who I'll introduce at the end are going to come in after we've done our 15 slides, so there's not too many slides, and just tell you about their experience of writing successful business cases and tips and tricks and stuff. We've also got a few business case templates, which we're not going to show you today. We're just going to send those out after the meeting. Can I ask people to just mute themselves? The last time we did that centrally, we got into a bit of a bother when we tried to bring people in to speak. So you can turn your camera off if you wish, but please just go on mute. Children and dogs are allowed to make appearances. That's no problem. And I think that's us, Indi. I think we can go to the next slide and I can hand it over to you.
So, yes, good afternoon, everyone. I'm Indi Singh, as Steve mentioned earlier. I'm one of the commercial program managers at the Health Innovation Northwest Coast. So I support SMEs with the spread and adoption of innovation technology within the healthcare sector. So I'm going to start off with a few slides, and the first one is what is the purpose of the business case? Now, all of you will have innovation technology that you'll want to get adopted within the healthcare system, and you may have various individuals within the system that are interested in your products. Now, in order to kind of get off the starting block, the business case is the key document that you'll need to kind of start focusing on, and that will provide the basis for the change and the transformation. And most business cases have like key elements, but they are adapted for the specific purpose that you are utilizing it for. Now, I want to kind of stress the NHS business case is different to the traditional business case that you may have utilized for funding or for acquisitions and the like. And the intention of today really is to give you some of those key elements that are within that business case and how you should be focusing your approach. Now, one of the kind of key elements is about making sure that the business case and the project demonstrates best value for money, affordability, deliverability, and the health economics. Thanks, Bill. Next slide. Okay, so the business case and the business case process, it's all about governance. It's getting a robust expenditure approval process to ensure that any projects that are adopted by the healthcare system go under a rigorous assessment, such that benefits, impact, efficiencies, income potential, financial consequences are considered. It's ensuring that all the resources are utilised appropriately, making sure that the limited resources we have and the use of taxpayers' money is undertaken in an appropriate manner. Now, this doesn't mean that once you've done a business case that you can't do changes. It allows for a basis from which changes can be subsequently made. But one of the key elements of business case and the business case process is to think about the prioritization. So how are we going to prioritize the use of government resources within the healthcare sector? And so ensuring that your project aligns with the priorities of the NHS organisation is very key, because if it doesn't, then it'll hinder its adoption within the process. Next slide, please, Phil. So who has the responsibility and the ownership of a business case? You may think it's yourself, but actually it's usually an NHS colleague. So your project that you present to the NHS and has some interest, you will need to get a sponsor. So that may be a consultant, it may be a nurse, it may be a department, it may be anyone that's within the NHS that has an interest. So they will be your sponsor. And once they've got their sponsor, you'll need to also have a multidisciplinary team. So it'll be surrounded by other people within that team that can support the actual whole process. And what you've got is to ensure that that project looks at improving patient services, increasing efficiencies, and generating income in some instances, not in all. And once again, it comes back to the point of making sure that these kind of points are considered when you're also looking at the objectives and priorities of that organization. It will be the sponsor that'll have to ensure the quality and the timely completion of the business case documents. And it can be other people as well that will be involved, such as the divisional finance managers, project managers, nursing, clinical, IT and estates. All these people will need to be involved in terms of getting the business case completed and all the elements ticked off. Okay, the next slide, please. So once you've got your business case completed in terms of the documentation and the content, then there's an approval process. And as you can imagine, it's a means of ensuring that only appropriate projects are approved and go through a suitable process of ensuring the legal powers that the organisation have are undertaken. In simple terms, that's really referring to ensuring that a project's operating within its financial limits. There is a hierarchy of approval. So depending on the size of your project will determine the various authorities that can approve on various committees that will be in place. Now that will vary from different organisations, NHS organisations, and even to hospitals. Similar hospitals may have different structures in getting that approval across the board. But business case, once approved by the board, also then provides the basis for ongoing assurance to ensure that it's implemented in the way that the guidelines are stipulated by that organisation. Next slide, please. Key thing is also to think about all the teams. We've talked about the multidisciplinary team that needs to be involved, but ensuring that all the teams are involved in that process. So if you do need to have, the IT department signing off the DTAC, for example, then that needs to be undertaken as part of that business case process and ensuring that's included within the documentation, because otherwise that will hinder adoption at some stage later. And then also what you've got to ensure is that the business case the documentation has sufficient details about the engagement by the department for monitoring to ensure that the actual project goes through a certain project plan for implementation, and then subsequent metrics are obtained to evaluate its success or not so, as the case may be. And that is usually then reported back to the board in terms of progress and subsequent contracts and commissioning. And some of the key aspects that will be included within that business case will be the clear responsibility, who the business case lies with, the various people that are involved, the criteria for success of that business case and its implementation, the various reporting structures, frequency and recipients, and then any escalation if things don't go to expectation. So what we're just trying to do is give you an overriding of the process that's in place, and once again to bear in mind that it slightly varies from organisation to organisation. Okay, so moving on to the next slide in terms of business case stages. So depending on the size of your project and depending upon that organisation and their ultimate guidelines in terms of adoption. They'll have the strategic outline case, which is really about strategic fit. Is this something that makes sense in terms of that they need for their service, for their hospital, or for their community service, as it may be? And have you considered affordable options? So you may be wondering, why would we be talking about options? Remember, the business case is something that is presented by an NHS sponsor. So they've got to ensure that they've considered other options, and this may be your other competitors. And here you've got to be bringing out your value proposition and making sure that you're able to differentiate why you're better and should be utilized in this circumstance. It's looking at the management capacity and the capability delivery, and ensuring that if you need clinical staff, that clinical time is available, and that this project can go ahead within the resources available to the organisation. And if that's some funding that's been provided by yourself or a grant, that releases staff from clinical duties such that they can then devote themselves to this project. So once you've got that strategic fit, then it may be an outline business case. The outline business case then goes into the appraisal of the options. So we may have mentioned the options previously, but now this kind of highlights whereby you stand out from the others, and the pilot that you've done identifies those metrics that make you be the appropriate option for this particular project. And it's looking at value for money, making sure that you've got the health economics information there, looking at any procurement processes, confirming funding and the affordability, and a detailed management plan. So even though you've got the business case process, that is to give the board and then the organisation the appropriate governance. So hence you still need a procurement process, so you still may need to go through that process in terms of the final adoption. And then you've got a full business case, which is probably going to be for the larger projects that are more detailed, where you need to have some technical information. Once again, the procurement process, affordability and value for money, that is looked in a bit more comprehensive manner, and to give a further information in terms of the overall benefits realization being the key thing for the organisation before it can kind of assess its success in terms of that project. So that's the kind of background in terms of the business case process and the stages, albeit once again I'll put in that disclaimer whereby each organisation may do it slightly differently, but it's around those kind of themes of ensuring value for money, affordability, making sure that the management and the various departmental managers are actually on board in terms of the project, and that the available resources are there to make sure it's implemented and is a success. Next slide, and I think that's over to you now, Steve.
Yeah, it is. Thanks, Andy. That was good. So we're just going to talk to you about a model called the 5 case model. And it looks at 5 domains: strategic, economic, commercial, finance, and management dimensions. So if we go to the next slide, we'll go into a little bit more detail. So behind these slides, you've got each of these built up, so there's more detail, but just the sort of summary on this slide is strategically, it needs to be a compelling case for change. From an economic point of view, it needs to be good use of taxpayers' money. You probably heard of the Lord Darcy review that's just come out. Only took 9 days to figure out what's wrong with the NHS. Commercially, it needs to be attractive from a procurement business point of view. The financial cases from start to finish, so it's the whole life of the awards, and the management is obviously the implementation and the delivery. So we just go to the next slide. I won't read through them all in too much detail, but all we've done here, thanks Phil, is take the 5 subjects and just expand it really. So when you read this, you'll recognise most of this, but it's just making sure that you don't forget this stuff. So, when you're making a case for change, you need to understand the drivers, what you're trying to change, what you're trying to improve, obviously smart objectives. So if you go to the next slide, Phil. So the economic case, that's really important. The profit margins in the NHS are pretty low. So, it's always quite hard to get inside the envelope. But making that economic case, and now it's coming more important too, the social value and net zero stuff. So it's not just about what the product can do and how much it might cost or what the service can do. The other thing we would like to sort of stress as well in this session is, although you might be bringing a product or a service into the NHS and it's either already in 10 hospitals and you're looking to get to the 11th, or it's the first time in one hospital or one clinical setting, don't forget, it's never just about the product or the service that you're offering. It's just, there'll be implications for the pathway, the processes, and clinical practice. Next slide, please, Phil. This is the third of the 5. So the commercial case, you probably know this stuff pretty well, but they want to see that you've got a procurement strategy, that you've looked at the risks, the contractual arrangements, so all the normal things you'd expect. Next slide, please, Phil. For the financial case, is it affordable? And then trying to figure out the preferred option from a provider point of view, from a trust point of view, whether it's capital or revenue. And then just the last slide, please, Phil. And then the management case. So this is about someone on the other side being able to describe the improvement to a patient or a system or a clinical team. And of course, there'll always be the risk and the governance and the project management. So they're the 5 case models. If we just go to the next slide, I think it should be great. Okay. So I think we've got Mark from C2AI, we've got Helen from Redmore, I think we've got Simon from Navinio, and I think has Leo joined from Febris as well. If you have, as we talked about, if people want to put their cameras on, great. So what I did warn you at the beginning that this is something boring, so we got the boring bit out of the way, and hopefully this is the interesting bit. Mark, can I bring you in first, please? So Mark's a pediatrician. He works for a company called C2AI. So unusually, he has been a clinician and now he is commercially selling to the NHS. So Mark, can I just bring you in with your experience of business cases?
Thanks, Steve and Indi. Yes, so as I'm sure all of you will be aware, it's a challenging environment, probably more so now than ever before. Clearly, money is difficult to get hold of, and particularly in a context where budgets are tight, the first thing that ends up going is innovation, typically. So being able to prove a return on investment, being able to prove productivity, and really get past the biggest hurdle, which will be the director of finance signing it off, is a critical part to this. Not only in terms of the business case for the here and now and getting the project off the ground, but ultimately in terms of sustainability and proving that you've hit the key markers around return on investment, such that the organisation will continue to procure it into the future. So my advice is twofold. First is understand from your sponsor who are the key stakeholders, who are the decision makers, and what is it that's going to make them tick. There is no point in putting together a business case unless you truly understand what is going to pass mustard for those who are going to make those decisions, in particular the director of finance, because they are going to have a very different set of metrics and profiles that they're going to be held to account to. And if they don't have budget, which is likely they won't, there's a very high bar that needs to be passed. So getting in front of the DOF early, getting an understanding of what their focus will be and what would resonate with them, I think is important. Clearly, productivity is going to be a key part of that, and being able to demonstrate that in a tangible way is important. But so too is making sure that you've got all of the allied influences on board, because the more noise that the target organisation can make on your behalf, the better that will be. The other things in terms of kind of just hygiene factors, it's good to be on a framework that.
Oh, Mark, I think that was going so well. I think we might have a frozen moment. And Helen, can you see if Mark's frozen from your end as well? Yeah. Okay. Well, look, what I might do.
While we're waiting for Mark to get back, I just want to really reiterate that point you made about stakeholder engagement. I think that's so important. I've seen really, really good, strong business cases that don't end up getting approved because that side of things and speaking to the people who are the decision makers hasn't been done thoroughly enough. So I think it's really important that you're not waiting till the meeting for people to be expressing concerns and raising objections and things. You're giving people the opportunity to be involved as an earlier stage as possible. So if they've got any issues with it, if they've got any hesitations around it, you can do all of that long before the meeting.
Yeah, it was going to be the same thing that I was going to sort of summarise on Ruth. That I think what was loud and clear from Mark when we had him was that sponsorship, that engagement, that key decision makers. Helen, can I bring you in?
Yeah, that's awesome. Hello, everybody. Okay, can you hear me?
Yeah, just
maybe better now.
That's good. Yeah.
Yeah, there's so much to it, but I think one of the things that I've learned, so I've been in the NHS for 25 years from a management point of view, so I've had to support clinicians and the wider system for delivery of services to get the business cases in. Working with Redmore, it's a lot more supportive around people who've got products or initiatives in how do we get those through. And I think one of the things that we're often guilty at when we're completely focused on our own product is we sit in a bit of an echo chamber. And one of the guilty things that we tend to do is just mark our own homework. Even if we want to go a little bit externally, we tend to go to a safe space or a safe person to be able to do that for us. But really what you need to be doing is putting yourself in a dragon's den situation. You want someone beforehand to absolutely grill you on everything, because somebody else will if you don't get that beforehand. And so you need to be really clear on your answers and your information and your around your product. But a little bit on what Mark was saying and what Ruth touched on around your stakeholders. The big one for me is the NHS now more than ever is looking for easier commissioning. They don't want to be commissioning in absolute silos. So where your product or service may fit into a particular care pathway or is a resolution to a particular, you need to be looking at where else along the patient journey or that staffing operational process are you touching points with other parts of that journey or that process. So it might not be your responsibility, but if a commissioner can see how it really slots in and then merges well into other organisations or products or services, that makes it much easier for them to actually see that bigger picture. Do you want me to carry on, or am I just lacking quick?
No, I'll bring you back in. But I mean, I think the reason I went 1-2 with you and Mark was obviously Mark's spent most of his life in an NHS hospital. And now he is working in a commercial role for C2AI. He tends to sell at ICB level. The real unique thing about Helen is Helen used to run primary care and our services, so she understands the really complicated setting, which is different, primary care. And what was interesting is I didn't expect you to say if you can make it more convenient for commissioners. That's a little bit obvious, actually, and it slots in and it merges well. But that makes it a bit more attractive from a commissioning point of view, not just a finance or provider point of view.
Yeah.
Great. I might bring you back in a second. Simon, can I bring you in if you're there? I can see you.
Hi, Steve. Yeah. I was going to run through a business case, Steve, but just to add to one of the points that I think Mark was about to make before we lost him, frameworks is something. We are a health tech business. We're small SME, as probably most of the people on this call are. We have seen benefits with the trust that we have already engaged in working with frameworks. So I think that's something that was key. I think Mark was about to say that. Some of the key ones like SBS, MTI, for example, I think that's been something that's been hugely beneficial for us. And I think that's just one thing I wanted to mention. The second one was because we are a digital health tech company, there's certain, criteria that the NHS have mandated for companies like ours to use, and there's one called the Digital Technology Assessment Criteria. That's something also just to be aware of, that needs to be completed, and I'm sure for different businesses there's also different documents that need to be completed. But yeah, that's just a couple of points just on extra there, Steve, that I just thought I'd add. Would you like me to run through the business case, or do you want to hold me for last on that?
Yeah, just hold on to that for a second. I just forgot to tee you up. I mean, both of us worked at Boston Scientific and Johnson & Johnson in different divisions at different times, but now you've gone from a device company to a digital company, from a big blue chip company to a small company. Can you describe the differences and the challenges? Because you're also wearing quite two unique hats today.
Yeah, absolutely, Steve. Yeah, I think first and foremost, coming from a commercial background, there are a lot of people doing a lot of different roles. I think it's a lot easier to get things done in a big commercial business. We think about the Medtronics, the Boston Scientifics, the J&Js, that there's whole teams that are set up to support the health economic arguments, for example, and to really build those cases. And I think coming over to a small business like Novenio, it was about looking at what they currently had and being able to fill the gaps. And I think that's certainly something the Health Innovation Network have really helped us with. And that's building the value proposition and linking that to the health economic piece. And that is, again, something which, I found in a small business, we just need to get our, hands dirty with, we need to just get involved with. And I think that's a big difference between the two. As I say, that key piece is the value proposition, and then linked to that is the health economic data, which then really proves to the end users that the technology works and that the efficiency gains that we see can be translated into clear health economic gains. And that's something, big difference that I've seen between the two, that we've just got to get stuck in an SME, bottom line.
Yeah. Mark, are you there? Did you manage to rejoin us?
Yes, apologies for that. Dodgy Wi-Fi my end.
Nothing dodgy about you. I think we got everything anyway, but I summarised after you dropped off. But I think Ruth picked up on the fact that it was the stakeholder engagement and the key decision makers in terms of the engagement and managing expectation and getting their endorsement and support. And then Helen went on to say, and Helen's quite unique, in that she used to run primary care out of our services. And now she works for Redmore that sells stuff to primary care. And one of her main points is about, if you make it easier and more convenient for the commissioners, your chance of success increases. And then Simon also worked at Boston Scientific and J&J and was gone from a big company to a small company. And he was just talking about the differences and the challenges. And I think he's going to talk to us about a business case example as well. I don't know if Leo from Fibris, is she there?
I'm here. Hello.
Hi, Leo. Did you want to come in and add anything from your point of view?
Yeah, sure. Sounds good. So really nice to meet everyone. So I'm Leo. I'm a policy and public affairs lead at Fibris. I've been with the company for about a year, but been in the health tech space for about a decade now. I think you've heard a lot of really useful information already. So I'm trying to think about kind of what I can add beyond that, and it'll be useful for Simon to go through the example, I think, later as well. I think based on what the other colleagues have shared as well, I think engagement is absolutely key. Making sure that you actually understand the priorities of the organization you're working with and how you're proposing aligns to that. That makes a massive difference. And that's where we've actually collaborated really well with the health innovation networks as well. So I definitely recommend using them as a mechanism for that too. I think what Helen mentioned around kind of testing and making sure that you create that environment where you can really get grilled and make sure that you touch every single point is extremely important, because you don't want to get to a stage where you've already submitted the business case and you can see other people can sort of spot lots of holes. That's obviously not the place that you want to be in. I think from my perspective, so I come from a journalism background initially, so obviously I have to mention this. I think for me, it's extremely important to think about the kind of the tone that you're writing the business case in. So that's something that I think about a lot. And then also the message that you're putting forward. So making sure that there's kind of a golden thread that runs through the entire document, because then your mission and your vision will be extremely clear, but then you'll also make sure that the person that reads it actually understands what you're trying to achieve and how that aligns with what they've got to grapple with on a day-to-day basis. Because the worst thing is you don't want someone to be reading the document and think, actually, I'm not really sure what you're trying to achieve, or I'm not really sure how that aligns with what I'm trying to do. So I think that's something that's extremely important and something that I try to think a lot of in my role. The only other thing I'd say is just to be also very flexible. So obviously there's a set kind of very clear structure that obviously I know that Steve's run through and Indi, which is really useful. I think also allowing space for kind of flexibility in that structure is good too, because maybe some teams and specific projects may want to add specific sessions as well, or may want to see some other information that you perhaps haven't used in another business case. So kind of keeping that in mind as well. And it goes back to that point around kind of engagement and collaboration, I think is really key. But as I say, these are the only other things that I'd add beyond all the great information that you've already heard from colleagues as well.
So that's really useful, actually, because you've made me think of an example around tone and message and golden thread. So I'm leading on a phase 3 SBRI bid with one of our trusts looking at stroke rehabilitation online. And I've convinced them in all of our answers, make sure these 4 points make an appearance all the time. This is about improving patient access, it's about improving workforce efficiency, it's about reducing carbon emissions, and it's about increasing out of what we call out-of-session rehabilitation for stroke patients. So they're not just having 1 hour of stroke rehab with a clinician a day, they're actually doing 2 or 3 hours themselves as well. So that's really important. Simon, can I bring you back in? Because I think you were going to give an example of where you've collaborated with another company, is that right?
Yeah, absolutely. Sodexo is a business that most of us will be familiar with if we're walking the corridors of NHS hospitals. But just to give a wee bit of context before I launch into that. So what Navenio do is we are infrastructure-free workflow solutions for intelligent tasking, workforce optimization. And I think the best way to describe it is if you think of Uber for the NHS, that's the best way to think about indoor location, being able to appropriately task the right person with the right task at the right time, and also link that very closely with asset to asset location, and the two work hand in hand. But also we work well with EPR systems and other systems that the NHS already have in use. So that's kind of a bit of background as to what we do. The business case that we wrote was with Sodexo, who we were jointly looking for opportunities to expand our business portfolios with joint solutions really that will deliver on value, improve cost structures, drive customer loyalty, and really expand our joint footprints across that trust and other trusts where we can apply that. So the solution that we developed was one that was focused on optimizing the Sodexo team member productivity. And if we think about a Sodexo or a Mighty, these are the kind of companies that sit very nicely alongside what we do and are in turn, as I say, what we call value added resellers. This is a value added reseller, therefore a joint opportunity, as I mentioned. And the opportunity or the objective was to get to enhance both patient and the clinician experience, with the objective of decreasing wait times and getting clinicians to refocus on patient needs at the bedside, rather than being focused on logistical tasks like arranging for a bed clean or something similar. It gets people back, or it gets our clinicians back to the bedside and focused on the patient, which is the key point. And what does that do? The overall work together improves patient flow with a wider objective to increase capacity within the NHS. So just focusing on some of those key outcomes, we experienced in this trust 22% productivity gain for patient transport and environmental services tasking. like bed cleans, like other cleans, etc. And it helped to optimize resource allocation and workflow. We also managed to get 15% productivity gains for team members who are not currently tasked, and also helped us and them gain a better understanding, and the hospital through the management portal, better understanding of workflows and different locations visited in the hospital, which in turn also helps with helps with disease tracking, etc., and infection control. And then just finishing off, it helps with bottlenecks in workflow, and then we can really help to pinpoint and address exactly who's doing what when, and that therefore feeds into further efficiency gains. And then finally, just to finish off, the first piece that we worked with was in relation to facilities management. Something else that Sodexo do is food services in NHS hospitals, and that's something which we're looking to add further down the line to further improve workflow efficiency, which is a module that we can add to what we were currently doing. So I hope that kind of gives an overview. Steve, is anything that I missed? Anything else you want me to focus on?
No, that's good. I think what I liked about that was quite a few people looked up when you said we're a bit like Uber, because actually what you did was use the metaphor. So you took something that's really complicated and got people to go, oh, it's like that. That's really convenient. That's just, it just means I'm not waiting around for a taxi. The closest one to me gets allocated to me.
Yeah.
Okay, cool. I think we're going to open it up to Q&A, and I know there's a question in the chat which I might ask Indi to have a look at. But does anyone want to ask me or my colleagues or any of my clients any general questions? Just unmute yourself and jump in if you do. Otherwise, I'll keep us going. We're nearly finished. No? Okay, any last comments from, I know I've got another couple of clients on there, Nick Mayhew, if you're still there, and Gareth and Phillips, Laura on there as well. If anyone wants to make any comments, just jump in now. Otherwise, I think I'm going to bring us to a close.
Steve, in terms of that email question, sorry, the question in the chat, what I'd suggest is that I probably pick that up separately. So I'm going to put my email address within the actual chat. So drop me an email and we can have a chat in a bit more depth. But can I just highlight that before you get into the business case process, what you need to do is be having informal chats with clinicians, with NHS colleagues, to see whether they have an interest in your product. You need to be networking with them, utilizing our services to make introductions, have those discussions. It's not a case of you just go off and do a business case and send it to a hospital and they'll adopt it. It doesn't work like that. The business case process, it comes secondary. The first thing is that engagement with the clinical setting and getting that buy-in from those clinical stakeholders.
So I'm going to use another metaphor. It's a bit like a CV. I think they should teach you this at school. Once you get into your 30s and you've got a bit of experience and you're gaining some expertise, someone having a word with whoever's hiring about you before the CV lands on their desk is what Indi's talking about there. So people being aware of what you're trying to change or improve or do. Because actually, I think what Indi's saying there is, if you want people to get it, you want people to comprehend it, and then you want them to be able to explain it to others. So I think most of you could probably go Navinio, Uber. You don't have to remember much more than that. But actually, if you wanted to know more, you'd just go back to Simon and speak to him. And the others haven't deliberately gone into their product, but we were just using that as an example. Helen?
Yeah, I think just sort of finishing off on that point, I know certainly from our experience, and we're like Simon on a lot of frameworks, that it's the relationship building beforehand. So when you're working your system, your arena, your sector, the relationships are really important, because a lot of them will come to you and say, I really like what you're doing. If you go through the framework and search up for this, we'll be able to find you directly. So they use the framework not only to commission off a business perspective, but they can do direct work as well, particularly if you're only, you're really niche in your market. But the other thing around some of the products and services that you may be offering is that we tend to go really heavily into what our product or what our service does. What people tend to fall down on quite a bit, and it's a biggie, particularly when you're working with organisations who are 24/7, 365 days, is what does the actual implementation mobilisation stage look like for them? So if they've got a huge staff base, because they're 24 hours, how is your product or your service actually mobilised and implemented from a training point of view? How do you do that really well? Where's the support and self-sustainability? So not environmental, because that's important, but how does your product and service self-sustain itself so it's not reliant on coming back to you all the time? That's a really key thing that I've found has helped us enormously.
Yeah, that's really useful. Thank you, Helen. I think I might just put something in the chat before I quickly do a close. Yeah, okay, so you can read that from the chat there. So just to bring us to a close, so first of all, thanks to Indi and my other colleagues for supporting this. As I did warn you, the first part will be boring. I hope the second part was interesting with Helen and Mark and Leo and Simon and Ruth. So we'll send the slides to you. This recording, I think, will also go out from Phil. There's a couple of templates, and it's a bit obvious what Indi said, but it's really important. Don't fill that in and send it to somebody if they're not in the tender process or they haven't met yet. Any other questions, just email myself and Indi. And just to give you the heads up, our next workshop will be a much more complicated subject. It's health economics, and we are going to be using a company who specialise in that to deliver the content on that particular day. So because you've attended this, you will naturally have an invitation to that. You don't have to attend, but if you wish to, or you've got colleagues who want to, please do. And I think I'll just say thanks for attending. I hope it was of some use to you. And if you need us, we're here.